And it's a great pleasure to hand over to somebody I just met today for the first time, I have to confess, although as is the way these days, you hear somebody's name and you look up on the internet and you find all sorts of things about them. And he is Professor Moses Bockarie. He's the director of the Center for Neglected Tropical Diseases at the Liverpool School of Tropical Medicine. And of course, Moses is wearing two hats. On the one hand, he's an expert in health systems and neglected tropical disease. And of course, on the other hand, he's a fellow Sierra Leonean. So Moses, you have family and friends there. We talked about that earlier. And please, I'd like you to take over and give us your presentation. Thank you.
Thank you very much, Ade, and thank you for all the people who organized this from ODI. My job here this afternoon is just to give you a first-time experience of what really fragile health systems infrastructure is. And I want to do that by sharing the experience of the people on the ground and move away a little bit from a lot of what's been in the press in terms of the photographs we see. So I'll not be talking about treatment centers or number of dead people or what's been happening to the bad roads in these fragile situations. But but about a week ago, I think last week, there was this thing in the newspaper that's on the slide now about the chief medical officer in Liberia, who is also the deputy minister of health, Dr. Barnes Dan. And in 2009, I went to Liberia and I had to talk to her about how we can establish a system for having interventions for neglected tropical diseases. Now, Liberia, we're talking about interventions for Ebola here, but in terms of interventions for other diseases which are not as aggressive as the Ebola virus, the system in Liberia was not even strong enough to accommodate that. And the other thing about this photograph is that Liberia, Sierra Leone, and Guinea have actually got what's the Mano River Union, where they have economic cooperation and also some health cooperation. And every year we meet these three countries. So there's been some cross-border activities involving these three countries. And I was actually in Liberia for that meeting. Next slide, please. Do I? Okay. Now you can see that that's a letter I got from Dr. Barnes Dan a few weeks. A few weeks ago, before she quarantined herself, having suspected that somebody in her office actually died of the Ebola virus. And what's important about this is that in the Liverpool School of Tropical Medicine Center for Neglected Tropical Diseases, we are implementing on behalf of DFID a program to eliminate lymphatic filariasis, and also, but after the Ebola outbreak, we had to know how the situation was in the Ministry of Health to handle what's happening in Liberia at the moment regarding the support that DFID is giving them. The next slide, please. Now, I think what is really important from this is that in a response from Dr. Dan is that, like, and I think it's important to read this, like since March 2014, the Ebola virus disease has spread throughout the country. Personally, and presently the country is in a state of emergency based on, I cannot read the story. Based on aforementioned, all routine health activities throughout the country have been suspended for time indefinite in order to allow all health personnel to actively participate in the fight against the Ebola virus. Therefore, I wish to inform you that all mass drug administration and monitoring and evaluation activities planned for neglected tropical diseases program for 2014 have been temporarily suspended until the situation in the country is under control. Now, this, I think, really just explains the fact that the country hasn't got the capacity to deal with any other thing apart from the Ebola right now. And the next slide, please. Now, this was again around 2010. I went to Sierra Leone. Two of my master's students wanted to do a project in Sierra Leone, and we went there with our microscopes. We were hoping to actually get into a lab. Now, we've had Dr. Nabarro talk about poor infrastructure with lab systems. But the thing is, it actually didn't. In Sierra Leone, we don't have a national research lab. So we went there and we had to set up in the office of the program manager. So imagine we're getting into these countries, not only technical expertise, we don't even have the facilities to deal with basic diagnostics. That's the situation we're facing. Next slide, please. And I think this one, this is a photograph actually from the New York Times, but about the sister in the Kenema Hospital that was losing a lot of her colleagues. But the reason why I put this here, a lot of people will be talking about the mortality rate among health workers, but this is just to focus on the fact that the Ebola virus disease is actually preying on love, care, and compassion. I mean, the people who are exposed are people who want to care for their children and people who want to embrace themselves because they love each other, and people who get involved in some of the rituals that Dr. Navarro was talking about. So why I put in this photo here is because 90% of the mortality is actually associated, 75% is associated with women. So 75% of the health workers that are dying are women. This is because they are really involved in health care, and they are also greatly involved in other care activities in the country. So, I just wanted to set this really background without going into the details that other people can go into, to just tell us what we are facing in terms of fragile health systems, low technical capacity, and the fact that the virus preys on love and care.
Moses, thank you very much for that. I'm so impressed that everybody's sticking to time, and it's great.